Welcome, everyone, to this Prevent Connect podcast. My name is Tori Vandelin, here with Prevent Connect. I am super excited to have my colleague and co-host, Ashley Klein Jimenez, join me on this podcast today, too. Ashley, how's it going?
Hey, Tori, I'm doing well, thank you. How are you today?
I'm doing great. Yeah, I'm really excited to have this conversation today about the Preventing and Addressing Child Sexual Abuse in Youth Serving Organizations, a desk guide for organizational leaders. And we have two of the authors of that desk guide on this podcast today. So, Elizabeth, Keith, welcome. Thank you so much for joining us. Would you mind introducing yourselves, what organizations you're coming from, and your role in creating this desk guide?
Sure, Tori. This is Elizabeth Letourneau. I am a professor in the Department of Mental Health at the Johns Hopkins Bloomberg School of Public Health, and I am the director of the Moore Center for the Prevention of Child Sexual Abuse. And the desk guide is something that we developed, Keith and I, in collaboration with several other colleagues, including Luciana Assini-Mayton, who works here with me at the Moore Center, Ben Matthews, who's a professor at Queensland University in Brisbane, Australia, and Don Palmer, who's a professor at the University of California, Davis. And I should also say we conducted this work in close collaboration with several large national youth serving organizations who we cannot name, but who we always want to thank for their partnership.
Thanks, Elizabeth. I'm Keith Kaufman. I'm a professor of psychology at Portland State University in Portland, Oregon. I'm trained as a clinical community psychologist, and my research focus over the last 35 years has been around prevention, as well as better understanding individuals who perpetrate abuse and how that contributes to prevention. And I also do safety consultation with a variety of different organizations. And my role was as a collaborator with Elizabeth and the team to develop the guide and some related research with that.
Great. Thank you both for giving us some insight to who you are. Can you provide a brief summary of the desk guide?
Well, brevity is neither mine nor, I would say, Keith's strong suit. But briefly, what we are trying to achieve, and I want to say that this guide is far from complete at this point. This is our initial foray into this particular collaboration, and so I do want to situate this as work that we hope is ongoing, and we do have some other projects that are bubbling along in this area. But what we wanted to do is to kind of take a step back and sort of scan the landscape of what already exists. What are youth serving organizations already putting into practice? We knew it was a lot. We didn't know how much until we did this study. We were kind of blown away, or at least I certainly was, at how much at least some youth serving organizations are already doing in the child sexual abuse prevention and intervention space. And we wanted to also look at what are the practice guidelines that are out there. There are several, of course, and to get a sense of where is there overlap between current practice that's actually being implemented and best practice recommendations, and what's missing. And from my perspective, one thing that I thought might be missing is some coordination among the different strategies that are being used. Certainly, a big missing piece is any evaluation of these strategies, and we were unable to address that. That's something we hope that kind of evaluation of prevention strategies within youth serving organizations is something we very much want to do in the future. We weren't able to do that within the funding and the time constraints of this particular project. But what we were able to do is really do what I think might be the first ever deep dive across large national youth serving organizations into what are their current practices, and then a similarly deep dive into existing best practice recommendations, and then crosswalking those to kind of highlight what is being done maybe what's missing. And something we came up with was maybe there's a little too much being done. And I'm gonna just see if Keith wants to weigh in on this too.
Thanks, Elizabeth. I thought you did a wonderful job of laying out the perspective and what we were thinking about. And, you know, it's such a big space when you think across all the different youth serving organizations that exist, and the varieties and the different forms and who they serve and where they focus. You know, this space in terms of safety becomes so critical, but it also becomes really critical to find ways to create more of an edge so that we can impact those instances where abuse still occurs. And I was really excited about this project because when Elizabeth pitched it, it really represented an opportunity to try to move the field forward in a way that was pretty different than what's been tried before. You get a lot of projects that add to little pieces, but they seem a little bit like more of the same. And Elizabeth's idea around this was just such a wonderful idea to look at a really different way of approaching this.
I would love for you to talk a little bit more about that, Elizabeth and Keith. You're talking about this is an opportunity to move the field forward. And so I'm wondering, how does the DESK Guide advance child sexual abuse prevention beyond previously existing guidelines that we've seen?
Sure. Let me start, and then I can pass it on to Elizabeth. But you know, we know that youth serving organizations across the country have really invested in looking for what the best ways are to go about advancing policy and expanding practice and looking at training. But as Elizabeth mentioned at the top of the program, part of our experience was that in starting to look at what they do, it could be really overwhelming. I mean, we ended up doing a small sampling across 4 different major youth serving organizations, and there were literally thousands of checklists and policies and practices and trainings. And really that was, I think, part of the impetus for thinking about the DESK Guide. Part of our concern was that what was lacking was any kind of overarching framework that would really guide how youth serving organizations really should think about enhancing safety, and especially enhancing safety that fit well for their own organization. And while more always seems like better, it really seemed in this case that more had the potential of getting in the way. And let me give you a couple of examples about that. Part of our observation was that you can really get some adverse kinds of effects when you really look at youth serving organizations of that more is better, with having more policies and more practices. And some of the things that you might see is you might see you know, problems where organizations take on these new best practices and they find it difficult to actually tailor that, or they don't tailor it to their organization, and it's not a very good fit, and as a result, it's not very effective. Another kind of difficulty that seems to come up is as you keep adding more, you end up with staff, excuse me, staff at times that have trouble incorporating this more and more in the way of policies and practices. And then you end up with a drift with staff not being able to implement all of these practices, or perhaps not implementing them as well as they could or should. And those were some of the things that really got us thinking that it shouldn't be just about more is better. It should be about thinking how you can create some overarching types of principles or guidelines that really helped organizations make better decisions about how they can tailor particular kinds of practices, whether it be training or policies or specific supervision or particular practices to their own institution, and really try to be a little bit more flexible about finding the best fit of these many different approaches to really get maximum benefit for what they do and who they serve.
That was great, Keith. If I could just make this even a little more concrete, you know, when we looked at best practice recommendations, we identified more than 260 discrete recommendations. And when you think about it, keeping an adult from sexually abusing a child, you know, that can be a complex process. But at least from where I sit, I don't think it needs 260 different steps or rules. And so that just seemed overwhelming. And then what we found, of course, as Keith said, is that the organizations were in fact even exceeding that number with the number of strategies that they were using to try to prevent and address child sexual abuse without tailoring them to the mission or the local realities. And so you might have a rule that there always has to be 2 adults present. That's a fairly common rule in some organizations. And there would be hundreds of these kind of discrete rules. But with almost any given rule, you could come up with situations where it might not apply. And with the 2 adult rule, it's easy to come up with those. You know, what if an adult is out sick or is late? You know, what if there's one child left at the end of an event whose parent is running late or forgot to pick them up? You know, there's so many situations in which an adult might find themselves alone with a child, even if you do your best to limit those. And what happens if you're breaking this rule all the time, or breaking all kinds of rules all the time because there's too many to manage or to even remember? And what you may inadvertently be doing is, as Don Palmer, who's an organizational sociologist, as he pointed out to us, what happens if you have so many rules that they can't be tracked, managed, or implemented, and that they're routinely or often broken, is you potentially are establishing an organizational culture in which rules get broken, and that's acceptable. And these rules pertain to child sexual abuse, and that may then pave the way for abuse to go unnoticed, undetected, or unaddressed. The other issue with discrete rules is that, as Keith noted, is that they sometimes don't fit. So there are organizations whose mission centers around one-on-one adult-child relationships. And we know those relationships can be hugely impactful, positively impactful for children. And requiring 2 adults is not going to work for that organization. So what we wanted to do was try to figure out, well, what are the rules trying to achieve? Like you're not trying to achieve always have 2 adults. You're trying to achieve safety. You're trying to establish a precedent where adult-child interactions are caring and professional, and where they can be interrupted or observable, or that there's some other method for identifying how is that interaction taking place? How is it happening? Is it a caring and professional relationship? Are these interactions caring and professional? And that's the goal. And you don't have to have 2 adults present to achieve that goal. You can use other strategies, like reaching out to kids and parents to ask them how the interactions are going, and collecting specific information that can help you identify if there's anything awry or if things are really going well.
And I just wanted to add, Elizabeth, that, you know, your example, I love that, because one of the things that we know from some of the research is that mentoring organizations that have set up these nice layers of protection that involve regular check-ins, not only with the youth, but as well as the parent and also the person who's providing the mentoring, that's been a very effective strategy, even though it isn't the strategy of you know, some staff member watching them through their whole interaction, or knowing exactly what's going on when they're spending time together. So, you know, I really think that does such a great job of punctuating this idea of understanding what the overarching goal of a set of safety procedures is really intended to be, and then tailoring it to the kind of organization you have, and being able to be effective.
Thanks for listening. Part 2 of this podcast is available now, linked on our website.